Yeah, now we're good.
Okay, thank you so much for um okay. So basically the very first figure was this figure, which we have known before. And a lot of the unknown unknowns and unknown knowns are now a part of our known knowns. So we have come together and we have learned quite a bit about the health disparities and what our impact, what disparities are within Muslim communities. And we would like to know what are some of the factors by which we can eliminate this. And since we are working with the Muslim communities and the mosque communities, we want to deploy the mosque PCOR toolkit to impact or to bring that patient-centered element to provide to do this work where by which we can impact. And we know that out of the altogether, when we work with health disparities, about 90% of this work is actually in our control. The 10%, the air and water quality and housing and transit, it's actually, these are bigger issues that we may not be able to impact or measure. But the rest of the 90%, really 90% of this for the health factors, this is what we can do something about, and which is a great thing, alhamdulillah. So knowing that social determinants of health is a combination pack between social justice and health, and patient-centeredness is really lies in between the two. So when we talk about patient-centeredness and we want to impact or bring patient-centeredness, we got to work with both ends. Even that is part of the reason why the clinical projects, which is comparative effective, the clinical research is now involving comparative effectiveness research, which is comparing the two modes, which one works, whether this process work or this particular method works or this particular method works, which is the one that's really making impact. That's what CER is all about. That's what PCORI is all about. And PCORI wants to know it would only, they recognize that things would only work when the patient wants it to work. So therefore, that element is the patient-centeredness is a big element, and we would strategically understand and how to effectively use every modality within the patient-centeredness to generate an impact. So again, these are some of the things that we have gone before: the economic stability, social and community context, and healthcare access and literacy. So why are we talking about this, right? Why are we talking? Because we are talking about the assets. We're now moving on to helping the communities so that we can help them that they need. Not here is a new diabetes pill and must take it. Here is a new blood pressure program that has come out, or chronic effective chronic care management program that you need to adopt, and here's what the doctor is going to tell you. No, we're going to see why is it that this particular patients can be or they can be helped if the blood pressure is not under control, if the blood sugar is not under control. What are some of the factors? I'll share with you guys one particular story, which is not a part of any of this presentation, but I got to share this one for you. One of my patients, when I ran home health, she ended up in the emergency room every middle of the month. Between 13th through 19th, she would end up in the ER. And now going on to the fourth month, and when she was coming back, I said, I got to go visit her and I need to know what's happening with her, because there is something which we are unable to take care of. And the nurses would go in, the CNA, the certified nursing assistant, would go in. Almost at least one clinical person would visit her every day. Either it's a nurse, it's a CNA, a physical therapist, and everyone has failed to list exactly why she was ending up in the ER. And at the fourth month, when she was coming back, we normally take care of patient in home health when the patient comes home from the hospital discharge. So I was running a home health agency back then. And um, uh, and I came to know that this particular patient, basically has uncontrolled diabetes. But why is the middle of the month? And I was like, there's got to be something else. They even predicted that she's going to go into the ER. And I would say, why? So I went into her home and looking around. It's a one bedroom small apartment in the back of Loretto Hospital, and she lives alone. She's single. She doesn't have anybody to take care of her, right? Beside the neighbors who is in and out, and it's the neighbor who actually calls the 911 saying that she has passed out. So I'm thinking, what exactly is going on? Why is the middle of the month? And I looked around in the apartment, went to the kitchen, and guess what? There was not a single thing that I found that was ready to eat or even stored in her pantry or in the kitchen. Every box was empty. She maybe had a little salt in there. There was no sugar in the house, no grain, no cereal, no cookies, nothing. Empty pans and empty boxes, nothing in the refrigerator. That was something that I had never experienced and never known that. And I found out that while talking to her, spoke to the neighbors, it took us about 2 days to get to the bottom of this. Turned out that what she would do is she would, as soon as she would get the food stamps, she would bring the groceries, cook every single thing that she has in her house, and feed the entire neighborhood and the community. And by the 10th and 11th of every month, she has completely ran out of food. So her blood sugar was dripping down to the extent that she was passing out. So and why would she do that? Because of social isolation. And this is a real story. My heart goes out, and I don't know how many people are like that, where we are trying to. So let's go back to this particular figure here. We talk about quality of care, access to care. We have 911. She lives behind Loretto Hospital, which is, maybe about really within a walking distance. She has access to care, not a problem at all. But 40% of the problem lies within social and economic factors. And that's what we are talking about here. And that's what we need. She did not need another insulin pen. She did not need another pill. She didn't need a doctor. She just needed somebody to talk to. She needed somebody so that she's comforted enough so she doesn't feel the need to feed the 1 month's grocery and cooking and feeding to the entire neighborhood. She didn't need to do that. But yet, she ended up in the ER. And that's where I think it's we need to understand how these factors play in and what we can do to eliminate some of the things. So when we look at this figure, we see that what are some of the assets that we're going to need then? We have a free clinic that that's coming up around the same time that our social engine would go up, so we can help out. However, there are many other free clinics out there, and I'm not sure if any one of them would have some kind of other programs like nutritional program, exercise or tobacco use or other sexual activity, alcohol and drug use, whatever need be. There's some of them are listed here, but many others are not listed here. So these are just the examples. What are some of the things that we can bring in to these assets? And I was also thinking that these particular figures is really can feed into the categories that we can have. Nabil, by the way, has created a very good, a really nice Excel sheet. We would be sharing it with you guys too. And so as I was preparing for this lecture today, this afternoon, it hit me that this figure is very important, much more than what we are giving attention to. And all of these are different categories where people can be plugged in to support that particular health factor, which would then directly impact in positive way towards the health disparity. So that's what we are really looking for, and keep thinking in those terms. We have a lot of these assets. We just need to link these things together and let the community be aware of the things that can happen. We also know that the top health concerns for the American Muslims that have been identified by the eMarch Project are some of these issues. Now, mental health, lack of culturally inappropriate, religious sensitive healthcare, underutilization of preventive services, reproductive and sexual health. See, over here, we do see that healthy behaviors and sexual activity is one of the factors that contributes, one of the factors towards the 30% and health behaviors towards the 30% of the health factors. So pretty much a lot of the items that have been identified by the eMarch project are really more of health, more of the healthy behavior factors, interpersonal trauma, Islamophobia, health-related impacts, elder care, immigrant health. A lot of these I do see it has to do with either socioeconomic factors or the health behavior factors. Mental health, yes, you can say that that's probably directly related to access to care and clinical care. Some of reproductive and sexual health is also towards clinical care and access to care. But other things, if you look at it, most of them are related to the other. So having this list in mind and then going back and looking at the different health factors, I think these would be crucial to guide us to mapping our assets. So I want you guys to think in those terms it just dawned at me literally, this morning. And that's what happens sometimes, that I have to revamp what I think first and then what comes out as a final product of the presentations. Anyways, knowing that we have these topics, we have the factors, and what are we doing currently with our community-based organization, with our research projects. We do a lot of advocacy. Many of us are involved in projects and in proposals and in organizations that feed into the policies, that feed into the to different regulations, not regulations per se, but I think policies definitely to some extent. Also, there are many network organizations that are helping out. So a lot of it is going on with respect to advocacy. Quite a bit is going on with research. Research is a domain which is relatively new to the Muslim community health. Yes, we have done advocacy with Obamacare. We actually saw many AMHP, Compassionate Care Network, Imana, ISNA, ICNA, all of these provided quite a bit of advocacy towards the Obamacare or Affordable Care Act, and we did go somewhere with it, alhamdulillah. But when it comes to the research projects, we're relatively new. So, now it's the time to differentiate exactly what we do that feeds into advocacy and what is it that we do that feeds into the research. So it is also important to distinguish or to differentiate between program and projects. A lot of advocacy is really related with the programs. Many healthcare organizations, community-based organizations, are currently running programs. We don't see very many projects. When it comes to projects, we probably hear a lot about international health projects than we hear about the local healthcare projects with our community. And we do see initiatives such as, there is a vaccine initiatives, or flu vaccines are pretty common, and the entire community has taken an initiative to promote flu vaccines in the different mosques. We also saw the COVID Task Force initiative by CIOGC. So all of these are good initiatives. I'm saying initiatives because I'm differentiating between a program, project, and initiative. I don't have initiative on here right now, but I just want to add to that these are small events that happen, and these events really are part of neither a program nor a project. This is simply an event, an initiative that people do it on a regular basis. Now, program is something which you do it over a period of time, and you can, or it may be an ongoing. For example, ICNA has the food pantry program and a shelter program, and every year they measure exactly how much they have done. They measure their outcomes, and they use those measures to raise the funds for the next year's programming. But they don't calculate the measurable outcomes. And it's the measurable outcomes with the exact scope, with the specific objectives within a particular amount of time that converts a program into a project. So when you see the programs here on your left side, once or recurring community health activities, events or campaigns, unspecified data collection, non-measurable goals. So this is what's feeding into your advocacy, versus the project that needs to feed into the research, which is you have cost and resources, you have specific time, and you have the scope of the work by which you are defining these goals. So the project activities are very different than the program activities. And again, I just want to reiterate the same point. You got nonprofit programs and you have the research projects. Now, patient-centeredness, it's what we are throwing in the middle between the projects and the nonprofit. Because if you look at it, if you bring these two together, literally, you can generate an entire cycle. So you can have a research project that can feed into your program, right? But with the patient-centeredness, this is going to be successful. So otherwise, you won't be able to, I mean, nonprofits do the programs. I mean, people donate because they feel good about it. People may need a flu vaccine. They would go in and take benefit out of it. Really, the entire community, what is the rate of vaccination in our community? We don't know that. Sometimes people can relate to the larger community, but we don't know exactly what is the rate of vaccination within different Muslim communities. I know a particular, there was a vaccine company that approached me personally. I was actually at an event, and they said that, well, they were in Omaha, Nebraska, and within that particular community, they tried very hard to penetrate it. This is a relatively new Somalian Muslim community, which actually did not allow them to come out and give out free vaccines to that community. Why was that? So and in fact, I actually know that community from the eMarch project. So, and I kind of know their behaviors, and so it is an interesting thing to see how somebody who is trying to do some good to the Muslim community may not be received as well, because they were missing that patient-centeredness. So anyways, let's go. So relating that to the PCORIs, we saw this too. And how does that patient-centeredness relate to that? Once you bring that patient-centeredness in between the research project and a nonprofit program, you are literally running a PCOR project. So you have you got the priorities from the nonprofit programs, because you have done the community health needs assessment. You know what is it that the community want, and those translate into the proposals and the research project objectives, and those then objectives would then have specific activities, research agenda, or a specific activities that actually feeds into the research results. So on one hand, so you have the research agenda on one end, and you got the research results on the other end. From the research agenda has to match the funding research. So, and that funding research would actually matches with the research results. So this entire cycle literally is there, feeds into every activity of this, literally feeds into each other. look at the priorities. We have Muslim community health priorities from eMarch. We brought the toolkit out. Now we are saying that we want to disseminate this toolkit into the larger community. And from that, we want to have a particular research agenda out. We are not at the research agenda yet. I want to be very explicit on that, because we don't know what is our research agenda. We know we have specific priorities within Muslim community. We know some of the factors of that relates to the health disparities within Muslim community, but do we have a research agenda? No, we don't, as a community. So I want you guys to think about those things, because when we are conducting a PCOR project or a PCOR project, we have these planning, conducting, and dissemination that Dr. Patela went through. So the PCOR project life cycle goes on in a very typical format. Now, with the EMPART project, we know that what we are doing is we are simply taking the toolkit and disseminating it within Muslim community, mosque community. But the way we are doing it is so that the PCOR toolkit can be adopted. PCOR toolkit primarily talks about how to run a PCOR project in a mosque community. That's what it talks about. It's not doing anything by itself, right? So what is it that we can do with the EMPART project? And how do we tell the community, or we disseminate the PCOR toolkit so that the community adopts it and see the impact that, yes, PCOR or patient-centeredness really has an impact. And what we are doing is we're actually giving the community what they need. We're bringing that element of patient-centeredness while handing them this PCOR toolkit, while telling them that we need to create a research agenda, and here is a tool by which we can come together to create the research agenda. Here is a tool that can help us do a research project in our community. And that's what we are doing. But if you're giving something to somebody, and if they are not thirsty or hungry, they're going to say that, no, I really don't need that. And hence, we have to see the blessing in what Allah subhanahu wa ta'ala gives us. And indeed, we need to translate that into their terms. And therefore, you give them, you want to say that, listen, you have an issue with some of the socioeconomic factors here. Let me help you with an asset. Let me bring you closer to what makes a difference in your life. And therefore, we're talking about all of these different tools and giving people doing something that really makes a difference. So I hope I'm not losing you guys in this. I want to do a quick see, I can't see you guys. I wanted to do a quick face check to see if you are with me. Anything? Is it making any sense to anybody? Is it making sense to you guys? What we're doing here? Okay. I still see some questions. Okay. Is it making sense, Asna? Okay. Okay. So now, PCOR methodology, we were here, so we know that this is how we are running a PCOR life cycle, PCOR project, right? But when you actually go in with the toolkit, and you're going in with the methodology, you're going in with the toolkit, you have many different communities around, many different aspects of the communities around, or many different groups of the communities around. You got schools, you got, the entire community, how and what we do, and what is it that really, bringing people to the same level of understanding. We have found out that what works, how do we get everybody to the same page? So we figured out, or we've employed the basically project management methodology with our communities. So what that does is you have all of these different groups of people and you want to bring them to the same page. So Picori actually has really done it very well, and in the sense that, and it took them quite some time to come up to this, and they admit this even on their websites. They say that lack of and they actually researched on this, that what is the biggest challenge to engaging all of these different people, because every one of them is going to come in from a very different perspective, right? What Dr. Barrow was talking about yesterday, you go in and somebody has a different one person has, they're looking at the project from their perspective. They're saying that, oh, I'm interested in schools, I'm interested in education, I'm interested in my patient, I'm interested in the medicine, I'm interested in having this park out there for kids, I'm interested in how does this project benefit me. So they would be looking at your objectives and saying that, what is it in it for me? And we actually, so lack of clarity, making sure that everyone is clear on what the objectives are and what exactly are the outcomes. That's what Picori calls lack of clarity is the biggest challenge to engagement. So with the Mosque Picor toolkit, what we did in the eMarch project was we actually brought in project management methodology. Now, I don't want to inundate you guys with another piece of toolkit or another bunch of tools with, but this is a part of the Mosque Picor toolkit. And we overlaid the Picor methodology with project management methodology. And project management, I call it the art and science of goals met. So it actually ensures that your project is a success and you're actually meeting your objectives and your goals. You actually, in fact, Picori themselves have a project management office, and they deploy many of the project management tools within their framework or within their management and their executive decision making, I want to say. So the project management really helps you when, how, and what. So it brings and literally there is a magic with this particular methodology. So whenever we hear the word methodology, we think of having a Bible, right? So whenever you hear the word methodology, you know it has a specific standards and a very defined way of doing things. So this particular, we have the Picor cycle, and I'm going to lay over it in a minute, but just think from the project perspective that project management actually basically has these 5 basic processes. So you have the initiating process here, you got planning and planning process, you got executing process, you got monitor and control, which the monitor and control process really encompasses the 4 processes together at any given point in time. And then finally, you have the close process. The 5 of these are actually, in Picori's term, are divvied up into 3 phases. So one of the things Picori has is actually it has added the business documents and the research questions as a part of the planning phase. And they say that just the research question takes about 75% of your time, and the actual project delivery is the 25% of the time. So conducting actually is a 25% of the time. So the initial phase is very long with any comparative effectiveness research or a research project, and the ending phase is also ends up as outcome measures in the longitudinal for the longitudinal impact. But you do have, it's a very similar cycle, and but what it does is it ensures that every person every person, meaning every stakeholder in the project, understands at all given point in times what the deliverables are, what are some of the key factors or the objectives of the project, and exactly what are the activities that we would be working with. So once again, just a reminder that we're going through planning, conducting, and dissemination as compared to the initiating, planning, executing, monitoring and control, and the closing. So we kind of, so when you overlay that, it comes out to be that you have a planning phase of the PCOR cycle that overlaps with the initiation and part of the planning phase of the project management cycle. The conducting phase is actually, now, why is that important? I'll tell you because in a minute. So you have the executing and monitoring and control. This kind of goes together, and it falls within the conducting phase. And then you have the dissemination phase, which is you're also executing the dissemination to who, and you're also controlling to who this is being disseminated to. So that kind of overlaps in the dissemination phase, and you actually close. So now, if you look at it, you have a research project cycle. You have a management project cycle here. So when you run both of them in parallel, you literally bring in the entire stakeholder community with you. Because think about it for a second. You're there as a researcher. You understand what went on to planning, what is going into conducting, and what is going into dissemination. You understand that in the scientific term. The rest of the community out there doesn't know those scientific terms. A lot of the MOSC stakeholders come from management. They come from information technology. They come from engineering background. Only 5% of them, as Dr. Padilla mentioned, they are actually physicians. And now these days, we actually find quite a bit of there are resources from the public health domain, but earlier we didn't have that in the previous generation, the older generation who's actually now in charge of the MOSC community these days. They don't understand it as, if you're not a doctor, what exactly are you doing? A lot to many of them, health administration doesn't really make much sense. They think that, it's probably have to do something with running a hospital, and that's about it. So but a lot of the domain of, and we know from our work that the health factors, 40% of them, 40 or actually 70% of them fall in the health administrative domain. So having the stakeholders that are from the management side and talking to them in a management language is going to do a lot of good to a scientific researcher, to bring them on board and to join forces to get their buy-in. Okay, so that's part of the reason why we adopted the two together, and we actually ran the eMarch project together. In fact, this very project, the eMPART project, I'm also running it the very same way. And I started out the initiation phase in the project management actually begins with whatever you close off in the previous project. So of course, that is, and you see that as an example where you leverage existing relationships. So what did we do for the eMPART? Worry-free community that runs other programs in the community. We leveraged existing relationships into the eMPART project. So we already are bringing in, that's why we are combining the affordable care health coverage, because people know from the previous projects, from the previous programs that that we have a track record, or we are doing something which actually creates result. It is easy for them to digest these materials then. Okay, so going on with a little bit more about the project management, one of the key things I want to relate to you guys is that these are the 5 phases: initiation, planning, implementation. Implementation, you can also call it execution and or execution phase, or monitor and control, and then you have a close. So all of these 5 phases tie in with 10 different knowledge areas. Okay, so the 10 different knowledge areas actually have very specific activities, and they give you sort of like a recipe of doing things. For example, project management also gives you a recipe of scope management or time management. We all can relate to time management. So what project management does is, in the methodology, each activity has a very specific time. So you say that, oh, for example, creating a presentation is going to take me 10 hours, but I didn't factor in that if I change my thought process, it's going to take me another 5 hours. So then now that I went out of the scope in there. So it gives you these tidbits that what do you do with each one of these knowledge areas. And once you understand these, it becomes very easy to manage a project. But I would highly recommend that when you are going into doing a project or conducting a project in the community, you probably do want to have somebody with a project management background on your project to help you guys run that. It actually helps to materialize the outcomes. It really does. Alhamdulillah. I've seen that with eMarch, and I've seen that with other projects. So one of the key things I wanted to point you guys here is that, see that stakeholder management right here? So project management also has a big stakeholder management recipe. However, I got to tell you, between PCORI and project management, when you combine these two, it's a dynamite, because project management doesn't have what PCORI has, and PCORI doesn't have what project management has. So I actually enjoy blending the two in, and we're going to actually do that tomorrow. We would take a very detailed look on a stakeholder management and a stakeholder engagement, actually. So a lot of you are concerned with how do you manage the people, and how would you manage some of the different groups. And so there are very specific strategies. There are specific recipes that actually come in handy. And with these 10 knowledge areas on board, you really can't go wrong with not having a successful project outcome. So I wanted to point you out the stakeholder management and the communications management right there. So these are the two things that we would actually work with. In fact, we would work with a project plan that includes the communications management, and it would include the stakeholder management, and of course cost management. And time management is going to be there as well. Time management, there is actually a timeline. I don't have a slide. You probably have seen that it's part of the social engine, or I uploaded that timeline to the social engine, and you may have seen that. If not, then I'll show it to you tomorrow. But there are 4 basic knowledge areas that we will be dealing with in the EM Park project. So you would get some kind of a taste for running that. Now, I just want to point this out that, you have 10 knowledge areas right here on the left side. You got 5 process areas here. See, there are a lot of blanks here, right? So basically, it's the planning phase that includes every single knowledge area. Now, the rest of the processes, the initiation and the executing and the monitor and control and close, really doesn't have too much in there. They are there in the close, for example, is there in the project integration management. And then you have our project integration knowledge area is there with the close and the initiation, but the rest of them are not. But if you look at the project stakeholder management at the end, you're covering, it's going on over throughout the entire project. And that's how crucial it is in order to do that. So yes, this particular slide, it can be inundated, but when you look at that, it's very easy to actually maneuver a project if you work with project management methodology. So I just want to give some examples here that some of the things that you will see. For example, right here at the initiation phase, project management calls for a project charter. And you'll see in a minute as what a project charter does. Over here, at this particular point, you would create a project plan. Over here, you have defined the project activities, which we actually do have as the outreach activities at the town hall and as the conference. And at the conference, we would actually be disseminating with the lessons learned. So see how the whole thing is kind of tying in together. And it's literally project management methodology helps us every step of the way to run a project, and you don't go, and it literally has the boundaries of the project, and you can't really go out of these boundaries. So you don't miss a step. That's the beauty of this particular methodology. So hopefully you would see, you can be definitely, you can take part of it. If any of you would love to help me out with as I'm running the project, and you can say that, oh, I would like to, come up with the stakeholder plan, or I would like to do risk management for the stakeholders, you're more than welcome. You're actually also already performing a lot of the project activities here in the executing phase, but I would really like you guys to be involved in lessons learned, and lessons learned would also deliver with as some of the publications. I would like you guys to be getting involved in the project planning phase, or doing the project plan, and what are the details that is involved in the communications. Being involved in the communications plan is another thing, and the communications plan is what we will see on Thursday, inshallah. But tomorrow we would work with the stakeholder management plan and the engagement plan, inshallah. So project initiation, and this is what a project charter does. So I want to leave a lot of time for the questions. So basically, project charter goes into the initiation phase of the plan, or it's sort of like a proposal for the grant project. But the grant project proposals, that they are 25, 50, 100 pages long. However, project chart, and that is the problem. If you give to the community member, to your mosque stakeholder, a 50-page plan, they're going to say, you know what, I'll read this some other time. Tell me, what do I need to do? Tell me what do you need from me? So it becomes very difficult for people to then take the entire 50-page plan and translate them into a nutshell. And that's why Dr. Rebecca has been talking about the elevator pitch. How would you do? And you guys were having a problem because, and it is, and in fact, back a couple sessions ago, even I was having a problem. And I realized that, listen, and I said, why is it that I know what I'm doing? I put the proposal in, I know what exactly is in the proposal. Why am I having a problem with the elevator pitch? And it hit me that the project charter is missing. And so I put together the project charter. It's a one-page document, and it brings everybody on the same page. That's what this project charter does. There are some key elements in project charter, and I want to make sure that you guys understand that the importance of project charter, because once you have a project charter, you can assure that this project will come to fruition in a very positive way. You can never guarantee the 100% deliverables met or outcomes ensured, but you can definitely say with a lot of confidence that the goals met criteria would actually be there. So it defines the purpose. It defines the objectives and delivery dates, the key stakeholders. It defines expected benefits. It defines the criteria for goals met or deliverables, basically. Who will sign off the project closure? That's what it comes out to be. The people who usually sponsors, they are the ones who signs off on the project closing. And in this case, it is actually PCORI. So when we deliver our objectives to PCORI signs off on the project, on the project, and they would ensure that the goals are met. So, but you need to, in order for us to deliver that to PCORI, you got to have the entire stakeholder community on board. And this just one piece of paper has the magic to do that, guys. Literally, that one piece of paper can do it. And you will see it, inshallah. So the project sponsor, it also tells you that who's the project sponsor. It tells you who the project initiators are. It tells you who the project manager is, because that's where the authority lies. That's where the liability lies. And that's where the responsibility for carrying out the goals met lies, basically. And it also, and it impacts, it tells you that establishes project sponsor's authority, or what this is the impact of the project charter, by the way, not the impact of the project itself. So it establishes the project sponsor's authority. It assigns project manager as authority, and it ensures that project completion's due date. So everyone knows what these dates are. Everybody knows what. So I've actually created a project charter, and I don't know if I can. This is a little small. Oh, here. I think I can do this. I'm trying to increase in the width or increase the, oh, I know I can do that. Here, import project. Okay, this I can do. So this is a better looking. So this will also be sitting in, and it would be in a PDF format. It would be sitting in with many of the on the social engine, and people can take a look at it. It's open to public. Pretty much all of these documents are. And so you can see that there's a project title. It's prepared by the sponsor. It's Worry-Free Community on behalf of patient-centered outcomes, because patient-centered outcomes research doesn't sign project charters. They sign proposals. So we do have their signature on the proposal, but they're not going to be on the project charter. However, we're signing on behalf of them because we are responsible to them. So that's what's happening here. So the effective date, the end date is right there. Project manager, it's this one, it's me. And it defines the opportunity, what it is. It puts the purpose out there, that to engage Muslim communities for the dissemination and adoption of the Mosque PCOR toolkit within mosque communities. And the way we are doing it is through asset mapping. So it establishes partnerships with mosque communities across Chicagoland area. These partnerships will serve as dissemination and implementation channels, train and mentor the community health workers in PCOR dissemination and implementation through staged activities, deliver a 2-day symposium tailored for mosque leaders and community health stakeholders, as well as the health clinic leaders. Deliverables, there's a timeline that's attached, which actually has specific dates of when what is going to be done. And the PCORI goals is, again, we have the goals listed in PCORI terms. And then we have the resources out there as project oversight, project coordinators, project consultant, and community. Now, this project charter is really there prior, or should be there prior to any of you coming on board. But once you guys are come on board, you become a part of the project plan. And so this is where it's 1 year, and the project cost is there, and I'm signing off on it because this is really because I'm the project manager on that. And we're also, as a Worry-Free Community, we're sponsoring it on behalf of PCORI, patient-centered outcomes. So any stakeholder that actually sees it, they look at it, they say that, okay, so we understand what you're doing. But if you look at it, part of asset mapping as such, or having a project management methodology, or having the health disparities, none of this is there. All of that is factored into our engagement plan. That's our engagement strategy with the stakeholders. That's what we are doing while the stakeholders are learning a lot about how an asset is helping them. You're actually engaging them, and you're the ones who are learning to become the community health worker researchers. See the connection there? Okay. Oh, I need to go back to my slides. So with this, I want to say that the next section topics that we would be working with. So basically, this is how we would be putting people on. All of these folks would be putting back on the same page through some of the materials that would be generated. So there's a project charter coming out. There's a project plan coming out. There's the stakeholder engagement plan. And in fact, the stakeholder engagement plan is also a PCORI deliverables as well. PCORI, in the proposal, PCORI asks you, how are you going to engage the stakeholders and how are you impacting your stakeholders? And what we are doing is we're doing that through asset mapping and through making sure that they get what they need to get. Okay, so a lot of these stakeholders that are there, they're looking at what is in it for me, and we are actually telling them that you're joining us, you're learning you're learning about health disparities, you're learning about doing a mosque PCOR project, and you're becoming a part of our social engine, so that this entire community is helping each other. We're bringing in the element of patient-centeredness, no matter who is doing what across the board. Okay. Okay, so going back to what we would be going from here, we would be going in with the mosques, with the site, with this, knowing that we have all of these tools in our bucket. We're turning ourselves to the mosques, and I didn't get a chance to talk to today, Asna and Bear again today. Spoke to some of you, so hopefully I would actually be putting out some of the other documents, and more than likely through the social engine, we would have the asset mapping categories out there. Think in the terms of the different priorities. Think in terms of categories for the asset mapping and how they're tying in with the health factors. So we are actually bringing patient-centeredness to our communities, right? So you would also have all of those items on the social engine. You would have the assignments or whatever you guys would decide when you want to choose your own communities. You will have that on the social engine. And on the social engine, we would also want to take a feedback as to if you want to have a separate group out there, or possibly run within the same group where you have most of the help. But there are quite a bunch of options out there. Okay. So with that, I want to turn my screen to oh, okay, that's a guide. Okay, so I want to ask I want to ask you guys as to give me some feedback. What are some of the questions? Or, by the way, did people get to do the survey from yesterday? Or was the survey? I may have sent. Did I send two forms, or did you guys get one form only? Okay, you guys got one form. That's good. Okay, perfect. And okay, we know a couple of them have not done, so I hope that two same forms. I wonder why, Wilson. Okay, we'll talk about that. Um, it is the same survey as you had before, though. It was the same. The questions were the very same, because we want to make sure that the first section, how was the first section and how was the second section, and then you'll probably get the same survey for the third section as well, which is putting it all together. Okay. So are there any questions from today's session?
There was a question out on the
Yeah,
chat.
can you give a specific example of how we would introduce asset mapping to the community members? Absolutely. So basically, what we are going to have a kickoff. It's a good question, Abdurrahman. So we're going to have a kickoff on November 1st, inshallah. And Bilal is working on the flyer, which should go out in a day or so, inshallah. And we that's at the kickoff meeting, we are introducing the concept of asset mapping. We're asking them if you guys have a particular service that you would like to, that is a Muslim, a culturally sensitive service, or a culturally appropriate service, in the sense that you may have, it doesn't have to be um, a, a very typical Islamic service. You can have, even just a primary care physician who has the staff that caters to the Muslim community. That's good enough. And because I know some some physicians, or I don't know of any primary care who doesn't, by the way, in greater Chicagoland area. Many of them do, but I know there are some specialty cares, which, for example, if there's an issue with a male or female, or even with primary care, there's an issue with a male or female. So that's culturally appropriate. So people like to go to the gender specific care providers. And so, they can add those assets onto our social engine. The other thing is that, so we are announcing it in the community. Um, Highlighted topic of interest. So you saw this is so this okay, I see what your actual question is. So the assets are being by the way, we have quite a bit of assets already in the community that all of you guys know, and we know from worry-free communities. So the very first step we want to do is actually map those onto the social engine. So we have a map. Listen, do we have a map available to look at today, or no? Can
Oh,
you?
no, we don't have that yet.
Okay. So tomorrow we're going to look at it. We would we actually we have a long list. For example, I'll tell you, we have free clinics that are out there that are our assets. We have food pantries that are Muslim, or that has halal stuff on there, or culturally appropriate food that we can put on. We have a few shelters or organizations that provide a community with shelter support. There are our elderly care organizations that are already there. So we have a bank of these resources, these assets within the community that we know of. And what we are going to be doing, Nabil has actually created a really good, and let me share that with you. So Nabil has created this list. I think you are seeing this already now on my screen. He has created this particular list with the assets that, and Dr. Rebecca has given us some guidance, alhamdulillah, because they've done it before in their community. So this is something, for example, mental health, personal safety, substance abuse or substance use, transportation, medical equipment, the life enrichment. So we have all of these different categories that we could use. We could also go back and tie these categories to directly with the health factors that we saw. But I think within the health factors, you probably would, even within housing, for example, you have independent living, you have, supportive living, you have senior living, you have long-term care. So within a particular category, you probably are going to have subcategories. So this is what we will do is, as a group, and this is going to be happening perhaps on Saturday. And that is the reason why we would like to have the Saturday session in person, so we can hash out some of these details as to how exactly we want to uh, categorize our assets, and how do you categorize them. So we already are starting with a list of assets that we have. We will be categorizing them, and we will be putting them as our assets starting November 1st. Literally, that's how, I mean, in the next 10 days, they're pretty packed on our end, by the way. So and that's why we need everybody's help, and all of you would be pulling in. So we would also have an Excel sheet out there, either on the social engine or on the Google Drive, where people would be can put in all the different assets onto the Google Sheets, and those assets can be uploaded. We don't have to type into the maps. The programmer is going to take the list, and he would simply upload it, and that would be connected with the it would be connected with the Google Business Drive. Also, it would also be connected online with the global the GIS service. That's what you call it, the mapping services. So you would know exactly on the map where are they at. So when we start doing the outreach starting the first week of November in the community, and you guys are answering people on the social engine, or there's a chat feature that's available, so you're answering them online, and somebody says, you know what, I really need to know about is there a help available for the food pantry in my area. I live in Joliet, so you can see that, oh, there is a place in Joliet. Yes, you do have a food pantry available, but no, or you don't have a food pantry available, and then we can actually start putting a list together where for the stuff that we don't have, and those are some of the stuff that we are going to go back and with the mosques, and we can ask them that, listen, your community members are asking for this particular resource. Do you have a resource? Or here's a resource that we found that we are putting on the map for your community users. So it would go both ways. Yeah, thank you, Dr. Becca. So we would start with what we have and go to the unknown. That's what we would do. Um, so it okay. Any other questions that we have? So I want to ask you guys who I would like to know who is going to be in person and who cannot attend in person. Can you attend in person the Saturday session? Okay, that's nice. Okay, very good. Very good. Okay, Jimmy, you got to try. You're too far off, and I do need to. Okay, Andy and Jimmy. Okay, okay, okay. Inshallah, Asim. Inshallah, Shema. Yeah, I would really like to have us in person so we can, and Jimmy and Andy, I know you guys are far off, um, but there is a way, and Andy, we need to set you up. You're out there in the city, and we have a mosque site out there on Elston. So we need to set you up with that community. And because of the need that's so great in that community, we need a backup for you as well. So we are here, and there's actually two other our staff members also support that community. But it would be nice if the community knows you as a liaison, and as a community health researcher, so we can actually introduce you to the community, because that's going to help you then set up the community health town hall. You would get to know the stakeholders would get to know you, and it's all about it's about engaging stakeholders and learning how to engage stakeholders, learning how to impact a particular community. And so we are a part of bigger organizations, and the bigger organizations do tend to do things in their own ways. But learning how to separate a research project from a program, and how do you uh, uh, get that goals, how do you define an objective, achieve it in a particular time, and create an impact. So that's what we are trying to do with the capacity building within the cohort here. So it is important for each one of you to actually make sure that you can take that skill set from this particular project, because that's what we are hoping, and we are really, it's laborsome and intensive. We are just bringing to you. We want you to be capable to run a PCOR project on your own, or partner with somebody to run a PCOR project. So you can bring in, or you are representative of an entire community, and you know as a PCOR ambassador, or as a PCOR trained PCOR trained staff, or PCOR trained researcher, community health worker, what can you bring, and how to bring, or how to do these things in the community. And unless you get connected and you actually brush up, or what's the word here, you actually engage with them, and you learn, and again, there are times where people will respond to you, there are times where people are not going to respond to you. But then you would say, what is it that I can do where I can change this person to respond, or what is it that they need, which they would respond? Because essentially health is every single person's area of interest, every one of them. And every single person can benefit from patient-centeredness. They just don't know how, and we don't know how to help them. So this is the exchange that we need to learn from this project. And these kind of capacity building projects don't come in very, very often. So I hope you guys make the best out of it. Anything else that we can do for you in terms of capacity building? Oh, Andy has a deadline to finish 40 pantry visits before the 30th. We have a couple pantries out here, Andy, by the way.
I have 13 priority communities that I have to focus on first.
Oh, priority communities. Okay.
So currently we are on a new grant cycle for a couple of communities. So we have to finish all these pantry visits before.
That's nice.
Yeah.
We also got to, and here is a great asset that you're bringing in. So out of all of these pantries, we would like to know, most definitely, because you can actually help out in the asset mapping, where we know that the communities in the that Elston, that North Chicago area, they need help with food, but we don't know where to send them for the Muslim, or for the halal or Islamic food, right? Exactly. So those are some of the things which we would definitely need help with.
That's what I'm still looking for too. Don't worry, I've had that question so many times in the last 2 days. I had it asked today, and I'm still in the process of trying to find.
Wow. And is it hard to come by?
Well, it just depends, because I've heard some pantries are kosher, and they don't know if that transfers over, so they don't want to say. So I need to ask the directors within the Greater Chicago Food Depository, because it's a new goal, how to make sure they can have culturally appropriate food, and especially for the Muslim community on the north side. Because right
Yeah,
now, the trailer
beautiful.
is vegetarian meals and more
Mm-hmm.
produce. And if people call ahead and say, like, please no pork, because the USDA is giving out literally 30 pounds of meat to a family. So it's an interesting thing.
Wow. And so have you heard about ICNA Pantry, ICNA?
Yes, I have.
Okay. How do they, in terms of meeting the need, how are they?
I can check my information, my community snapshots. Yeah, if any of you want GCFD's research for a specific community, we have some suburbs and most neighborhoods in the city of Chicago, and just kind of like, unfortunately, I asked that as well with the ethnic declarations. It's however they self-identify, but you can see how many people need SNAP in the area that qualify for SNAP but are not enrolled in SNAP.
Mm-hmm.
How much pounds of food are going out into those communities. So I
Mm-hmm.
have that information too if anyone's interested.
Mm.
But I can look that up for you and give it to you. So you can.
Sure. We definitely would, and see this is an interesting way that how they assess the need in the community, as to by identifying what kind of demographics it is, and exactly how many people are on food stamp, and the ones they should be on food stamps and they're not, because a lot of people either do not, especially immigrant communities, and we know that for a fact, because when we tell them, they have been living here for years and they don't know that this is a service that they can avail. So we tell them that, and they say that, really, do I qualify for it? I didn't know that. So they definitely, those are some of the things that can come in very handy. Any other things, guys? So if not, then inshallah we will see each other tomorrow, at 5 o'clock.